My precious husband fought a long, hard battle with cancer, and he was my priority for years, and for the last 3 years especially, that he was not able to do hardly anything for himself, and I did anything that he couldn't, I did. And during that time, if you're doing that much for somebody else, you don't have time to think about yourself. You don't have time to think. Then when he died, that's when it hit me that I had let my health go, because I didn't have to. But I did, because I wanted to make sure that I did everything I could for him. But when I realized I needed to do something, that's when no doctor in Sylva had time to talk to me. But I got a group that did better than any doctor that I've ever been to, and they said, yes, we can see you tomorrow.
She had a scare. Her lips were turning blue, and had went to the hospital, and they kept saying, no, she's got acid reflux. And I called, and Dr. Segal called back and said, don't let them give you discharge papers, don't sign the discharge papers, tell them that they need to look at her and they need to run tests. We were able to get to the root of it. She was just forgetting to breathe. They rushed her to pediatric ICU. So if I would have gone home and signed the discharge papers, she could possibly not be here.
And I had no insurance, no money, didn't know what I was going to do. So I came in, I met Dr. Steiner. Of course, I was scared and crying. I couldn't have made it without him. I wouldn't know which way to turn. But they did. And it's really scary to think what I would have done without them, because it was fast growing, aggressive, cancer invasive, kind of spreads really, really fast. With me, with no money, no insurance, it would have took me longer and it could have cost me my life.
Pat came to us the day after her husband had died, and I saw in her something that I've seen in a lot of people over a number of years. They are so exhausted physically and financially sometimes from caring for an ill person that their own health suffers.
It made a tremendous difference. It lifted a tremendous load to know that now I would have some help.
She has not been, up till now, on standard of care medications for her condition, and we're in the process of getting those for her. And I think that's going to make a big difference for her.
I have seen Autumn since she was a baby, and Andrew, and then Jeremiah, and last Julia. And so I'm glad that we're continuing to provide care for the children, and I'm very glad that she has a place to come and receive care for herself.
I was with Dr. Segal at Mission, and they closed down, and she said she was switching over to Blue Ridge Health, and she also told me that they also take me as a patient as well. So I was like, okay, well, I'll bring my 4 kids and I'll come along too.
I'm one of those people that sort of fell through the cracks. I had to have an emergency room trip because it was the only thing I could get, and the doctor basically told me I was falling apart.
I met Lois about a year ago when she came to our clinic to be established as a patient.
I have to work, I have to help support my family, I have to buy groceries, gas, everything. And I have to be there for my granddaughter.
We started her on blood pressure medications. We gave her some information on therapeutic lifestyle changes, and then we ultimately ended up starting her on a cholesterol-lowering medication. All of this in an effort to prevent any bad outcome in the next 10, 20 years.
The care is absolutely excellent. You can't get better care.
We're in 7 different counties now, serving the needs of the underserved. And it's just been phenomenal growth, not even just locations, but in our service lines as well.
And especially, again, the lower income people. It would give them hope when there has been no hope.
We've been able to take those services to those communities, so patients aren't having to travel to only one location. Blue Ridge Health can take care of them in their own communities.
I worked at Good Samaritan Clinic for years and volunteered there, and so it is an absolute pleasure to be working in Blue Ridge Sylva, which is sort of the next manifestation of that free clinic. The patients who were formerly at the Good Samaritan Clinic and who are now Blue Ridge Silva patients, I think they can sense that there is a more stable base of care. So people are being seen sooner. There are more services available for people at Blue Ridge Silva, and it's a new, inspiring setting.
We really need the community's support, whether that's through government or private donors, in order to help us continue the great work that we do to see patients again in multiple venues within Western North Carolina, provide extensive services to them.
Philanthropy is extremely important to our organization. Without donors, without additional funding, we wouldn't be able to offer all of the services that we have.
Our vision is, again, to be the provider of choice for patients, to be really the solution to the healthcare problem in this country, in North Carolina, in Western North Carolina.
You feel like you're a part of something bigger than yourself. And being asked to do stuff like this, tell people about it, hey, give me a sign, I'll carry it up and down Silva, up and down the street.
Our cost for care to the healthcare system should bring attention to what we do. This is the answer, if you will, to our healthcare crisis. Our quality is top-notch, and I want to continue that and to push that to a different level.
Blue Ridge is definitely a good investment because we're always going to be serving at the community level as a community health center. And I think that that's just a way to kind of give back to your own community. Tons of stories about patients who, were desperate, they had no other place to go, they were kind of at the end of their rope, so to speak, and Blue Ridge was able to be there for them at that critical moment.
They're just wonderful.
I want to thank all the donors. If it wasn't for them, it wouldn't be possible for us to come as a family and get the care we need to get.
And thank God through Blue Ridge, I mean, they're great. I was right in here.
The people at Blue Ridge show compassion to all their patients, and it's just like a big giving circle.
Blue Ridge saved my life. Without them, I probably wouldn't be sitting here telling this story.
With your help, they can get even bigger and better things going for people.